The southern African nation of Zambia is reportedly buckling under the pressure of a major cholera outbreak that has killed over 400 people with thousands others infected. Authorities in the country have ordered schools to stay closed after the festive season holidays. Government has embarked on preventative campaigns, particularly in the most impacted areas. We're now joined by Cosmas Sakala, Acting Secretary General of the Zambia Red Cross Society. Thank you very much, sir, for your time this afternoon. Perhaps if we can get an update in terms of what the situation is like in the country at this hour, at least.
For sure, as you have put it right, that we have been battling with the cholera outbreak in Zambia since October 2023. And indeed, the cases have been increasing and reaching almost the peak in the last maybe a week or two, before the epidemic started exhibiting a little bit downward spiral, but still more, recording in excess of 400 plus cases each day. That, according to the update that we're being given by the government, we have reached in excess of 10,400 plus cases as that of 16th January 2023. And 24, and death rate going as high as in excess of 400 people cumulatively since the epidemic started in October 2023. Yeah, so this is really the situation. You find that the epicenter is definitely in Lusaka, the capital city of Zambia. That's where the main cases are coming from. If we are recording cases 440, for example, you'll find that maybe 380, 370 of those cases are actually coming from Lusaka, with other provinces that are hit, like Central Province, which is second from Lusaka Province, and also cases being reported in other districts. More than 40 districts around the country have recorded the cases of cholera. So this is the current situation that we are in with regards to the cholera outbreak.
Mr. Sakala, we understand that a soccer stadium in the capital of Lusaka has been repurposed into a treatment center. How does that work?
Yes, so you find that initially we had the treatment centers around the 6 sub-districts of Lusaka district. But when the cases surged, the government had to establish a bigger, arrange for a bigger place to treat cholera cases to meet the increase of cases. So they had to repurpose the Repurposed Stadium located in Lusaka, the capital city, to be able to absorb the many cases that were being reported. So I think that might have worked quite well, because the smaller treatment units in the sub-districts could not have contained the high numbers of cases that the country reported in the past weeks.
Is it really working well? We've seen reports of family members who are none the wiser as to, one, the condition, or two, the actual well-being of their loved ones, whether they're alive or not, as they've had to be on the other side of the fence, particularly at that treatment center, the stadium that has been repurposed. How does that work?
I think the situation is far much better now, because I think there's some systems now through which the communities, though they not have access to go inside the treatment center, just as a way to prevent further spread and even protecting their lives, the place is restricted, of course, as one of infection prevention and control measures. Now there's, I think, much more system that people outside are able to be given information about their beloved ones inside the treatment center. So we've seen even members of some Red Cross volunteers that are being now also joining the system, so that they create a link between the patients inside and their relatives that are hanging around the treatment center, the Repurposed Stadium in Lusaka.
Mr. Sakala, do you remember when the first case was reported in October? How many cases? 1. 2, how did it spread so quickly? You said October, so that's November, December, January, in just 3 months.
Yeah, initially, if I may not tell exactly from the index case, of course, was reported in October. You may wish also to know that we were coming from another outbreak, which was declared in January 2023, which are quite prolonged, and it started in the Eastern Province, and of course, it touched many other districts. At the end of that outbreak, there was some few months in between, and a fresh outbreak ensued. So, of course, it started with smaller numbers and in Lusaka. But all of a sudden, we began to record cases in excess of 100 per day, and it went to 200, 300, and surged, I think, in a week or 2 ago, to recording maybe the highest was when we recorded in excess of 700, in excess of 700 cases per day. So the increase from index case to 10,000 plus today, close to 11,000, I think has increased over probably fewer weeks, probably in the past 2-3 weeks, because we began to record a relatively higher number. In 2 days, you get 1,000, close to 1,000. And it moved very fast to get to where it is. But you'll be interested also to know that when we hit what we may say the peak, we're not too sure whether this will be really the peak of the current epidemic, but given the current trend, the highest was reached around 2 weeks, a week or 2 weeks ago, but the cases have started dropping from recording cases of excess of 700 per day to recording 400, again 380 something per day, though now the numbers again seem to be getting to 400, in excess of 400, but at least it's still lower than the peak that we have reached in the last 2 weeks. So we've seen the trend literally somewhat reducing, but still at a higher level. And probably with other interventions that I think with heightened interventions and restricting the enforcement of the Public Health Act or related laws, with the administration of the oral cholera vaccine, and I think we are optimistic that the cases should begin to reduce going forward.
Do you have enough vaccines?
Yes, I may not say enough vaccines, because already I think we vaccines in excess of probably 1.1 million, next 1 million vaccines doses, I think have been mobilized, have already been received, and some more vaccines will be received. But as to whether that will be adequate, I think we need to further get it from the Minister of Health, because Lusaka alone has got a population of excess of 3 million, for instance. Then the doses around plus minus around 1,700 doses, which means the doses might not cater for everybody, but definitely the priority district, the hot spots, would be prioritized so that we don't just give every Jim and Jack. But I'm pretty sure that the minister has indicated that they'll be able to prioritize to give to those hot spots, and it will be a single dose, meaning they'll just have protection about 6 months. So how far the minister has indicated, has given update to the nation, that those who receive these vaccines will receive a single dose than 2 shots, which give protection maybe for 2 years. So a single shot will give protection at least for 6 months, a period for during which I think other long-lasting intervention should be put in place.
Mr. Sakala, sir, please help us understand, because there are some reports that suggest this is a countrywide problem, but you have mentioned that there's the epicenter and then there's hotspots. So the country is working. You are open to visitors. The situation is under control. Do people need to fear, or do people scratch out Zambia off their visiting list? Is it a countrywide problem, I guess, we're trying to establish, or there's parts that are functioning?
Yeah, I think the system, the country is functioning, despite applying or strengthening the public health regulations. That helps to curb the spread of epidemic like this one. The country is functional, and as I've said that yes, we have recorded, the country has recorded the cholera cases in other provinces, maybe 9 out of 10 provinces, at least we have had at least a case of cholera, but the numbers are far much lower in many other provinces. The highest numbers are coming from Lusaka. So Lusaka province is like the main area where it is affected. Furthermore, within Lusaka province, the Lusaka district is the main place that has been affected, and is counting for a higher proportion of the numbers that are being reported, of the deaths that are being reported.
Thank you so much, sir. Just finally, I mean, there are reports that are abound where they are linking cholera, and they're saying it's strongly linked to poverty. This just blew my mind. Can you just debunk some of the myths about cholera? Can we really link it to poverty? What is it linked to?
No, I know naturally that people have already said cholera is probably a poor man's disease, because people may not have access to basic amenities. But we've seen that the drivers of the current cholera and even the past cholera epidemics, I think the ministry, working together with other partners, have been very clear about the key drivers of these epidemics, and indeed the current cholera epidemic, that it is consumption of contaminated water, consumption of contaminated food, poor hygiene practices. As to whether we directly say this has been caused because of poverty, I feel, but we can also, we've seen these poverty levels in Zambia existing many other years, but we didn't have cholera outbreak. We currently the cholera, the poverty levels are like around 60%, and the numbers have been around that for many years. So maybe those speculations to say cholera is a poor man's disease, maybe the saying seeks to insinuate that if you don't have access, if you are poor, probably you may not have access to clean and safe water. But when you look at poor hygiene practices, I think they are just attitudinal issues rather than necessarily the issues of poverty. So I would not outright relate to that, but I would relate it to sometimes our own practices as a people. We may have the money, but have very poor health-seeking behavior, very poor hygiene practices.
Got you. Thank you very much, sir.
Yeah, I would not. Yeah.
Cosmas Sakala, Acting General Secretary General of the Zambia Red Cross Society.